Okay, so I had to do this a little bit in a different way just because I had to go out of town last minute, so I wasn't able to do it with a partner. However, I'm just going to talk about the different kinds of contraceptives and what some common concerns would be. So there's three main kinds. There's intrauterine devices or IUDs, there's birth control pills, and there's birth control shots. They all aim to do the same thing, which is prevent pregnancy, but they kind of use some different methods on how to get there. So the first one being an IUD, this is a device that is inserted into the uterus that will block ovulation, which prevents eggs from coming down the fallopian tubes down into the uterus. So in order to prevent that, it those are inserted through the cervix. It's like a manual placement, and those can last quite a bit, and they're pretty effective. The other one is the birth control pills. These are like oral contraceptives is another one. These contain two hormones, both estrogen and progestin, and those will prevent ovulation, so the ovaries don't release an egg at all. So that doesn't matter if there's sperm present or if there's anything else there, the egg won't be released from the ovary. The other one is going to be a birth control shot, which is there's a few different kinds of them. This releases progestin, similar to what the oral contraceptives do, but the shot lasts about 3 months and it also thickens the cervical mucus, which helps kill which helps kill and prevent sperm from even entering the uterus at all. So they all can affect the menstrual cycle quite a bit. Most of the time it can regulate them. Birth control is often given to women who also have problems with irregular periods. That helps reduce pain. And then there's some of them that affect more than others. Birth control pills will affect the hormones a lot more than an IUD would. But they all, like I said, have the same purpose, same function. So a couple of things that concern people most of the time are infertility is a big one. So it's a super common concern. A lot of the research that has been done shows that these in the long term don't affect somebody to the point of becoming infertile. But a lot of times a doctor will have someone on these for a little bit or a long time, and that can help regulate their periods, which can also help with fertility because stuff is timed out a little bit better when you come off of the birth control. The other thing, a lot of concerns people have, especially with IUDs, is going to be the insertion. It's a pretty invasive process, I would say. So these insertions are done without any anesthetic. They use the same kind of equipment they would use for a pap smear, and then it uses almost kind of like a syringe that is inserted into the cervix and will place the IUD there. All of these are effective methods. A lot of them have 99% or more effectiveness. It doesn't mean they're 100%. Nothing bad ever happens. But in the long run, you do want to always practice safe sex, even if you are on birth control, just to prevent any unplanned pregnancies. I still made a script for like if I had a partner, but like I said, I wasn't able to get one for this one, but I have it filled out and I will submit it along with the video. Thanks.